hypertension, stress, trying to study from. I should not say this, but you should probably fake like मेरा कुत्ता मर गया या मेरी बिल्ली मर गई और मेरे घर की गाय मर गई or something. I just picked up the medication from my cat. She has cancer. Let's hope it works. I hope it dies. Hello everyone, my name is Dr. Anuj Pachhel. In this video, I'll be doing a medical meme review. I'll be watching medical memes and reviewing them out of 10. So without any further ado, let's start. On my iPad, I've got some amazing videos and photos of medical memes. So let's react to them every time. Skipping a topic because I don't understand it. Not understanding a topic because I skipped it. As a mystery, I face this quite a lot because I used to skip the topics which are not really important for examination. So yes, this is sort of relatable. But nowadays, since Marrow is a thing, you don't really face this issue a lot. Real image of third years holding an instrument in ENT posting and getting yelled at. So whenever you're giving an exam of any surgical subject, for example ENT, Obs, Gynae, surgery, you're always given instruments. So they ask you, okay, what is this instrument? You have to hold it in the way that you have to use it and also tell about its uses and all of that. So most of the times when we are given it for the first time, and that is usually the time postings ka jo post-10 ka viva hota hai, we mess it up very badly. So it does happen. Types of headaches: migraine, hypertension, stress, trying to study from. KDT is a book for pharmacology. It's a great book. I studied from it. Some people don't like it, so I'll rate the last meme 5 out of 10. Me too, organs after learning palpation in class, trying it on my friends and then failing to feel anything. Come on, coward, where are you? So during a palpation, it is actually normal to not feel any organ. If you can feel any organ on palpation, that is pathological.
अरे कहना क्या चाहते हो?
For example, when you palpate the liver, if you're feeling your liver, then you probably have some sort of hepatomegaly because you've been having, so much fatty food recently. And if you're trying to feel your spleen, if you're feeling it, you might be suffering from some condition that causes splenomegaly. So, palpating organs is a very good thing that we do in our clinics, and it gives us a hint about which system we are actually dealing with. So it's very nice. You can't feel your organs. The only organ I think which you can feel is a distended urinary bladder and sometimes a uterus in females, but that's all. My friends to each other after our exam related midnight mental breakdowns. One day the sadness will end. Yes, this is very true. We all have these moments, and if you have good friends, these moments reduce quite a lot. I suffered from this almost every single time before I gave my examination and totally relate to this. This meme deserves 7 out of 10. The way I've seen my friends become doctors, I don't trust doctors anymore. Same. I personally wouldn't send my patients to a lot of my friends that I know, a lot of my juniors I know, but because I have seen how they study, I have seen their methods, but I know that studying in med school is not even a fraction of what it's like being an actual doctor. I'm pretty sure I'll be one of the persons in somebody else's list that they don't want to send a patient towards. When you graduate, but then you realize you're about to be an intern. Internship training program is associated for MBBS for 1 year. After 4.5 years of your theory, you give 1 year of internship, that is just working in the hospital. I'm an intern, I'm doing that thing right now, and the meme is trying to depict that this guy is really old by the end of 4.5 years, and then after that he's going into internship as a very old person. So let's talk about this a little bit. You see, it's always thought about that medical profession is so long, it's extremely lengthy, and it's difficult to complete it. I agree with you completely, but it's not like ये सबसे लंबा course in the world, because med schools in USA run for 6 years, the residency program runs for 6 years. So it's a huge difference compared to the other countries. In India, it's pretty short. So yes, sure, it is long, but I personally believe that MBBS को 4.5 years लगते हैं पढ़ने को. It cannot be shorter than this because it's too much of a syllabus for too short of a time. Especially in final year, it is very hectic. People who take drugs, people who study drugs. So people who take drugs definitely don't look that good. If you're a person who is taking drugs, I imagine you to be the lowest form of human life possible, because you have to artificially inject chemicals inside your body that make you feel happy. How shallow can your life be? It cannot get worse than this, I personally imagine. When you're still a student but the patient says, "Thank you doctor," this is the most pleasurable feeling that you get as a med student. 10 out of 10 meme, absolutely relate to it. So I am like 6 feet 2 inches in real life, and that's pretty surprising to you. I know you have not seen me in real life. So when I walk around, I'm just an intern and I walk around with a stethoscope and with my scrubs and everything. When I sometimes go to the patient just for taking the sample, all the relatives stand up and ask me कि बड़े डॉक्टर साहब आ गए हैं. So like I have to reassure them, नहीं यार मैं बस intern हूँ, बड़े डॉक्टर साहब अभी आने के हैं, वो आएंगे. So yes, it does feel great when somebody calls you as doctor when you're still med student. When it's your first day at clinical rotations, पीपी पहना है, स्टेथोस्कोप लगा है, ग्लव्स पहने हैं, जो 2 लेयर ऑफ ग्लव्स पहने. I think this is the cutest meme of all time. So 10 out of 10 meme again. I remember when it was my first day of clinical rotations, I was in the neonatal ICU. I actually made a vlog about it. So I did not know how to actually take a sample. I did not know how to put an intracath. And my very dear seniors at that point taught me all of that. So it was like a complete orientation to internship. Pretty fun. But the surgeon asks you to hand them something in the theater and you have no idea what they're referring to. I have never been given the chance to hand out something to the surgeon during the OTs done because I haven't attended that many OTs yet. Surgery posting शुरू होने की actually कल से है मेरी surgery posting, आज मेरा MICU खत्म हुआ. But the most important thing is that you make sure that the sterility of the instrument is maintained, otherwise it will be absolutely wasted. If somebody asks you कि मुझे Langenbeck retractor, then you give them a Morris retractor, you'll probably be yelled at during the OT period. 7 out of 10. When you're taking the socks and dressings off your diabetic patient's foot and the toe comes off with it. So, diabetes का एक complication होता है, it's called diabetic foot. So what happens in diabetic foot is that since your glucose levels are so high, your nerves are practically dead. You won't be able to realize micro trauma which is happening, and that micro trauma will soon get infected. That infection won't be able to clear off. Why? Because your circulation is also damaged. It's a microvascular disease. And now what will happen is that along with that infection, your nerves are gone, so you won't feel any pain. Plus there is so much sugar over there that what will happen? The bacteria will start eating all of that glucose and grow rapidly. It will cause a huge ulcerative foot, and that is what we call as diabetic foot, and it's a very grave prognosis. You literally have to cut the foot off just to save the patient's life. So if you have diabetes, make sure that you are wearing proper footwear, make sure you're doing proper foot care and taking care of your blood sugar levels, keeping them in check, keeping your HbA1c at your target, that is like 8 or 7.5 or something like that. When you work night shifts and have twice the work with half the resources but still get it done, we are God's unwanted children, so be it. Night shifts are super fun. I made an entire vlog about it. Please do check it out after this one is done. For any place that I've worked the night shift, most of the night it is chill, right? Except for the few, bursts when you have to work quite a lot. So for most of the night shifts, it's okay. But sometimes it do be like that, man. 8 out of 10. Take me somewhere expensive, takes you to the ICU. So the medical care in India, especially in government, is very cheap. There are so many different schemes that we apply. So let's say that you are a neonate, you have GSSY scheme which can be applied. Let's say that you are suffering from TB, uski scheme hai. It's cancer, uski scheme hai. If you want something like angiography or stenting done for CAD, then we have a scheme that is, कौन सा वाला स्कीम है वो, नाम भूल गया मैं उसका, कोई तो भी है स्कीम. So if you come to a government hospital, you're definitely going to get a treatment for almost 1 to 2% the price it will cost you in the private sector. But at the same time, don't expect the 100% top quality healthcare that you will be getting in private, because in private there will be 10 people who are looking at one patient, whereas in government hospitals there will be like 2 or 3 residents who will be mostly responsible for the entire ward. Of course, a lot of different consultants and everybody are going to be coming and looking at you, but you will not be their topmost priority as you will be in the private hospital, because वहाँ पे पैसे की बात होती है. 5 out of 10. These two have got to be the dumbest people. I got it late, but I did. So you can see she's like, visually you can see that the abdomen is distended, and then she's looking at the pregnancy test and be like, oh my god, I'm pregnant. So an interesting story. This is literally a very true story that happened to me. So when I was posted in an obs and gynae unit, I was given कि वो वाली case है, उसकी जाके history ले लो. I asked her, okay, so when did you know that you were pregnant? And she literally replied to me कि I knew that I was pregnant last month. She was 9 months pregnant when I met her. So she knew she was pregnant at the 8th month. At the 8th month of her pregnancy, she knew that शायद मैं pregnant हूँ, and she did that because the complaint was she was getting edema feet and her BP was high. So it was all signs of preeclampsia. She was already a mother of one child and she was pregnant with the second one. So as you're already a mother, you might have felt the movement of the fetus right from the second trimester since the 20 or 22nd week. How is it that you ignored it all for so long? You might have a history of amenorrhea for like 9 months, and how is it that you still did not know? But she was like, I ignored all of that. I just felt like it could be something like normal. I asked her कि तुम्हारा पेट इतना बड़ा हो रहा है, did you notice? So she said, मुझे लग रहा था मेरा diet increase हो रहा है इसलिए मैं मोटी हो रही हूँ. I was so shocked. I mean, there are cases who literally don't know they have been pregnant for such a long period of time, and then suddenly, there you go, congratulations, have a baby now. There goes my hero. Man forged head injury to get months off work and then returned being rude to everyone, citing that his personality had been altered by the incident. So this could happen. This could potentially happen if there is like a prefrontal or the frontal cortex damage. But you should not fake a head injury. You should fake something like, I should not say this, but you should probably fake like मेरा कुत्ता मर गया या मेरी बिल्ली मर गई और मेरे घर की गाय मर गई or something like that. Lasagna or endocarditis? So I can tell first वाला endocarditis है, ये वाला right side का lasagna है, endocarditis, lasagna. And now I'm confused. Lasagna, endocarditis, and endocarditis. Endocarditis is the infection of the valve leaflets of your heart, and it's a grave condition. Like it's a life-threatening condition. The patients are directly admitted in the ICU. We perform a 2D echo and we can see the microvegetations. The patient has so many symptoms, right from a high-grade fever to changes in the heart sound to a cardiac failure which could be happening, and it's really bad. So lasagna खाता खाता अब मुझे endocarditis की याद आएगी. Pray for my bro. I have diabetes type 1. Bro, type 2 1. 10 out of 10 meme. Diabetes type 1 is insulin dependent, type 2 is non-insulin dependent, type 1 में ketoacidosis और type 2 में HSS होता है. A lot of differences, you'll probably read it in pathology. Doctor, we couldn't save his hand in the surgery. We're sorry. Woman, you said he was going to be alright. Doctor, well, his left hand is gone, so he is going to be alright. It's a dark joke. I like it. 10 out of 10. ICU nurse watching me Google ACLS algorithm during Code Blue. Code Blue is a cardiac emergency. It's basically cardiac arrest. That is Code Blue. And ACLS guideline जो होती है वो तब follow होती है. And you should be aware कि इतने मिनट में you have to do CPR, इतने मिनट में epinephrine देना होता है, intracardiac देना है, peripheral NORAD देना है. All of these are part of the ACLS program. Pregnant, non-pregnant, positive. So that's a pill. Hope you feel better. Quarantine. Are you stupid? So I imagine in America the COVID test kits were looking like that. Therefore the confusion. 10 by 10. Doctor, we are about to start. How do you feel? I'm so nervous. 10 by 10. I just picked up the medication from my cat. She has cancer. Let's hope it works. I hope it dies. Autocorrect be like does delivery. 10 by 10 meme. I like dark memes. So anti-cancer drugs are themselves poisons. Literally, they are literally poisons. They kill off cells of the human body. ऐसी चीज़ों को हम poisons बोलते हैं. Me, I have a headache. WebMD. And it will be your last. In the last video, in my case files video, I said don't Google your symptoms too frequently. You should go visit a doctor. Medics palpating, percussing, and auscultating. Radiologists. Look what they need just to mimic the fraction of our power. Radiology is an amazing field, and without them and without pathology, diagnosis is impossible. So yes, those were all the medical memes that I wanted to react to today. I really hope that you enjoyed. If you did, please make sure to hit the like button and also subscribe my channel for more such amazing videos. I'll see you guys in the next one. Goodbye, take care, stay healthy, stay happy.